Hello and welcome. Today we're diving deep into a condition that can quite literally turn your world upside down: labyrinthitis. We'll explore what it is, why it happens, and how it's managed. So, buckle up as we navigate the complexities of this inner ear disorder and aim to shed some light on this disorienting ailment. Labyrinthitis occurs when the labyrinth, a delicate structure within your inner ear, becomes inflamed. But what causes this inflammation? The most common culprits are viral infections. These can be common cold viruses, influenza, or even herpes viruses like chickenpox or shingles. In rarer cases, bacterial infections can also trigger labyrinthitis. These are often secondary to middle ear infections or, in extremely rare cases, meningitis. Certain autoimmune conditions, allergies, and even some medications have also been linked to labyrinthitis, although these are far less common causes. Now, let's understand what's happening inside your ear when labyrinthitis strikes. The labyrinth is responsible for both hearing and balance. It contains sensory organs that detect movement and position, sending this information to your brain. When the labyrinth becomes inflamed, these signals become distorted and inaccurate. This mismatch between what your inner ear is telling your brain and what your eyes and body are sensing is what leads to the hallmark symptoms of vertigo, dizziness, and imbalance. The inflammation can also affect the cochlea, which is responsible for hearing, potentially leading to hearing loss or tinnitus. Labyrinthitis can affect people of all ages, but it's most commonly seen in adults between the ages of 30 and 60. The exact number of people affected each year is difficult to determine, as many cases may go unreported or misdiagnosed. However, it's estimated that viral labyrinthitis is significantly more common than bacterial labyrinthitis. People with weakened immune systems or a history of ear infections may be at a higher risk of developing labyrinthitis. The symptoms of labyrinthitis can be quite dramatic and often develop suddenly. The most prominent symptom is vertigo, a spinning sensation that makes it difficult to maintain balance. This can be accompanied by dizziness, nausea, and vomiting. Many people also experience nystagmus, which are involuntary rapid eye movements. Hearing loss or tinnitus, a ringing or buzzing in the ears, can also occur. In some cases, individuals may experience difficulty concentrating, blurred vision, and a feeling of fullness in the ear. The severity and duration of symptoms can vary widely from person to person. Diagnosing labyrinthitis typically involves a thorough medical history and physical examination by a doctor. They will assess your balance, coordination, and hearing. The doctor may also perform specific tests to evaluate the function of your inner ear, such as the Dix-Hallpike maneuver to rule out benign paroxysmal positional vertigo (BPPV). Another common cause of vertigo, an audiogram or hearing test, can determine if there is any hearing loss. In some cases, imaging studies like an MRI or CT scan may be necessary to rule out other conditions, such as a stroke or brain tumor. While labyrinthitis is the general condition, it's often helpful to categorize it based on the cause or the symptoms. You might hear it described as viral or bacterial labyrinthitis, depending on the source of the infection. Some doctors might classify it based on the severity of hearing loss or the presence of specific symptoms like tinnitus. However, the main distinction is generally based on the underlying cause of viral or bacterial infection. Treatment for labyrinthitis focuses on managing the symptoms and addressing the underlying cause. If a bacterial infection is suspected, antibiotics will be prescribed. For viral labyrinthitis, there is no specific antiviral treatment, so management focuses on symptom relief. Medications like antihistamines, antiemetics, and benzodiazepines can help alleviate nausea, vomiting, and dizziness. Corticosteroids may be prescribed to reduce inflammation. Vestibular rehabilitation therapy, a type of physical therapy, can help improve balance and reduce dizziness over time. Rest and hydration are also crucial for recovery. Unfortunately, there's no foolproof way to completely prevent labyrinthitis. However, certain measures can help reduce your risk. Practicing good hygiene, such as frequent hand washing, can help prevent viral infections. Prompt treatment of ear infections can prevent them from spreading to the inner ear. If you have an autoimmune condition or allergies, managing these conditions effectively may also help reduce your risk. Finally, be aware of potential side effects of medications that can affect the inner ear and discuss any concerns with your doctor. The prognosis for labyrinthitis is generally good, with most people making a full recovery within a few weeks to a few months. However, some individuals may experience lingering dizziness or balance problems even after the infection has cleared. Vestibular rehabilitation therapy can be particularly helpful in these cases. Recent research is exploring new ways to improve vestibular function after inner ear damage, including the use of stem cell therapy and gene therapy. While these are still in early stages of development, they offer hope for future treatments to further enhance recovery from labyrinthitis and other vestibular disorders.